This video is developed to give an overall idea to the user about the process of blood donation. This knowledge will empower you to get on the journey to become a regular blood donor and also help in clearing the myths and doubts associated with the process of blood donation. There are 5 sequential steps in the blood donation process. 1. Donor registration and questionnaire filling. 2. Counseling. 3 is medical examination. 4 is the actual blood donation process, and 5 is post donation rest with refreshment. So, we look at the donor registration and questionnaire filling. Your name and address are documented in a register or computer, and thus you are registered for the blood donation. After registering for blood donation, you will be given a donor questionnaire which has 5 parts to be filled up by the prospective donor. First part is demographic details and contact information. Please carry a photo identity card with you to verify your identity. Next section is regarding your present health status. You should be feeling well on the day of donation, slept adequately the previous night, and had a good healthy meal within 4 hours of coming for donation. Third section is about any past illness, surgeries, medications, hospital admissions, vaccinations, blood transfusions, etc. Fourth section is about any high risk behavior like unprotected sexual contact, sharing of needles, alcohol and other addictive drug usage which may make your blood unsafe for the patient. Fill up the information truthfully, and if you have any doubts, feel free to discuss with the counselor or the doctor. Your information will be kept confidential and privacy will be respected. Fifth section is the consent part, where you put your signature on the form to inform us that you have understood all the information regarding blood donation and cleared all your doubts, and after that you have voluntarily given consent for blood donation. This also includes your willingness to get your donated blood tested for 5 infections which can be transmitted through blood, namely HIV, hepatitis B and C, malaria and syphilis. The results of the test will be shared with you only with your consent, so that makes it important to give your correct contact number. Please remember, all the questions asked are to ensure safety of the donor and the donated unit. Hence, do not falsify information. It can unknowingly harm your health or the health of the patient receiving the donated blood. Once the donor registration form is filled, you proceed for counseling. This is a one-to-one interaction where the counselor discusses issues related to the donor health and the donation process before, during and after donation, ensuring audiovisual privacy and confidentiality. This includes explaining about the entire blood donation process, ensuring that the donor understands all the questions and responds accurately to the donor questionnaire, and also explain about unsafe practices which can affect donor safety, so that individuals can self-defer themselves if they are suffering from an infection, disease or health condition which may make them unsuitable to donate blood. Finally, the doctor will decide regarding your acceptance as a blood donor. Please remember, blood safety starts with the selection of a safe donor. Since the quality of the final blood product depends on the quality of the donor, all this information and examination are very important before accepting an individual as a blood donor.